Hi, my name is Jennifer Pierre. I'm a nurse practitioner student from Maryville University. I'm going to be doing my cardiac assessment today. This is my patient. Okay. I also want to show my ID. Can you see it? All right. Before we get started, we're going to do a 360 of the room. All right, you can come closer. All right, so this is my patient. I just want to let you know I'm a nurse practitioner student at Maryville University. I'm going to be doing your cardiac assessment today. The first thing that I'm going to do is inspect my patient, inspect his skin, make sure that there's no cyanosis or any discolorations in his skin, and just checking his lips, making sure that they're not blue or cyanotic or anything like that, which would be could indicate any heart problems or issues. I do like to also look at the legs too, just to make sure that there's no edema or anything like that on the legs, which there's not, or any discolorations, okay, because that could also indicate heart problems. The next thing I'm going to do for my cardiac assessment is palpate. So I'm going to palpate first the precordium. I'm going to start at the left sternal border. And here I'm checking for any lifts or heaves. If there's lifts or heaves at the left sternal border, it could indicate right ventricular hypertrophy. I'm going to turn over to that apex here. If I feel any lifts or heaves at the apex here, this could indicate left ventricular hypertrophy, or even a lateral downward feeling of that apical pulse. Then I'm going to go up here to the base, again feeling for any lifts or heaves. I'm going to ask my patient to turn over to his left side, and this is going to help bring the heart closer to the chest wall, because if there's any lifts or heaves, it'll help me feel it a little bit better. And again, the left sternal border, the apex, and then the base. Okay, I'm going to ask my patient to turn back over. Okay, great. So here I'm just going to feel the fifth intercostal space here, and I'm going to feel for the PMI, the point of maximum impulse. And then while I'm doing that, I'm also going to feel the carotid, and that's just going to help me to differentiate between the S2 and the S1. The carotid coincides with the S1. Okay, great. All right, the next thing I'm going to do is I'm going to percuss. I'm going to have you put this arm just like right behind your head here. Okay, just like this kind of. And I'm going to percuss, and we're just going to estimate the heart size. This is not anything that's exact. It's just an estimation. If I felt like, maybe it was enlarged, or, there was any gross abnormalities, I would definitely send my patient to have x-rays done, okay, to confirm that. So we're just going to percuss here. A little mark here. Just check down here again. Okay, good. So it looks like that the apex is kind of starting right over there somewhere. Actually, hold on. Yeah, right there. All right, and it doesn't look like it's abnormal or anything like that. You can put your hand down for me. Okay. The next thing I'm going to do for my patient for the cardiac assessment is actually listen to his heart. So I'm going to listen to his heart with him lying like this first. And the first thing I'm going to do is listen to the right sternal border, second intercostal space. This is going to be the aortic region. This region is best to listen for the aortic valve. Okay, the second intercostal space is the pulmonic region. I can best hear the pulmonic valve here. The third intercostal space is Erb's point. I can best hear the semilunar valves, which is the pulmonic and the aortic valve here. The fourth intercostal space is your tricuspid area. I can hear the tricuspid valve best here. And then, of course, the the fifth intercostal space, midclavicular line, is my apical pulse. The mitral valve, I can hear best here. Okay, and what I'm going to do also is just feel his carotid again. Okay, and I'm just going to listen for 1 minute. All right, so his heart rate is about 60, which is normal. It's a very good heart rate. So what I'm going to have you do is turn over to your left side. Patient. My patient's falling asleep. All right, put your arm to the back, and we're going to listen again. Again, I'm having him turn to his left side because it's going to help bring the heart to the to the chest wall, help me hear it better. Okay, so the second intercostal space, right sternal border, the aortic region. And I'm listening for if there's any murmurs or anything like that, and I don't hear any abnormalities, any irregularities in his heartbeat. That's a second intercostal space, right, left sternal border, the pulmonic region. Now I'm going down to the third intercostal space, left sternal border, the Erb's point. That sounds good. The fourth intercostal space, tricuspid area. And then the fifth intercostal space, midclavicular region. And yeah, I don't hear any murmurs, and that's what I'm checking for. Okay, you can turn back over. All right, and it looks like everything is good. Even when I palpated, I'm checking for lifts and heaves. I didn't feel any lifts or heaves or anything like that. My patient's skin looks good, and that is going to be the end of my cardiac assessment. Thank you.